sore right foot, right groin, and left shoulder.
Yes.
Possibly trying for a family?
Yeah.
Yeah. Hold. Lovely. Okay, we've got frankincense and mandarin. We have a lot of hormonal activity down here because of the reproductive system. So it's tender inside the hip there.
Yeah.
So it's about there.
Yeah.
Yeah.
100%.
So I'm moving the pelvis to try and create some flow, some softness. This is the foot with a little bit of pain. Yeah. I can feel it right there. That feels all right.
Yeah, brilliant. Yeah.
Wow. And again. Nice, good. The neck release, up and let go, all the way back, letting your head naturally tilt. Beautiful. So, welcome to the bothy. Thank you for coming all this way.
Yeah.
How far have you travelled?
It's probably 90 miles or something like that. I think so.
Oh, I'm absolutely honoured. So I'm going to treat you like royalty because you've travelled so far. You've booked a core therapy and a full treatment, as I call it, which is the full massage, including a facial. So you're going to be here about 3 hours.
Okay.
Yeah.
Yeah.
And you've already completed your consultation form, Elizabeth.
Yeah.
So you haven't got too many issues, or you don't get headaches?
No headaches.
Not particularly stressed, although you might be right now after that journey.
A little bit now, yeah.
Oh,
but no, not particularly stressed in general, no.
Lovely, good. You mentioned in your consultation notes that you have a sore right foot, right groin, so it's probably all linked, and left shoulder.
Yes.
So this often happens with bodies, and we notice it in core therapy, and it's like a zig-zag effect.
Right.
And so when we're walking, standing, running, whatever we're doing, it has a reverberation through the body, and pain will go in this format, in a zigzag.
Okay.
So I'm not too surprised by where you're finding pain, and I'm hoping with the core therapy particularly that we will find out why and treat it. And even after that first hour you should feel better.
Okay,
and then
good
I'll
stuff.
go on to massage and you'll feel even better.
Yeah.
The other thing you mentioned was possibly trying for a family.
Yeah.
Yeah. And are you doing any investigations or any treatment at the moment?
I was going to go for a blood test to see if there's anything wrong. However, the GP said that if there was anything wrong, we wouldn't get the funding for IVF anyway. So I just thought, well, I might as well just do it naturally, see if we can just do it naturally.
Yeah.
See if there is anything.
Yeah.
Because we can't afford the IVF treatment because my partner's already got a child already. So that was the hindrance, really.
Is that why you wouldn't be eligible for...
Yeah.
Is it?
Yeah.
Oh, that's a shame. I didn't realise that.
I didn't.
No.
The GP did say it was unfair, but that's just how it is.
The thing is, there are other things they can do besides IVF. So there are fertility drugs they can give you, which is obviously far cheaper than whole IVF experience. So it might still be worth doing the investigations just to find out what might be causing it, whether it's you or him, whether it's a combination of when you come together something happens, or whether there's some blockage. You know, for your health anyway, it might be worth just finding out. I'd encourage you to. How long have you been trying now?
I've been off the pill. I was on the pill for 10 years, so I came off it October last year.
Okay, so about 13 months. Yeah, so they normally say come to us after trying for at least a year, so that's about now. So just to put your mind at rest, really. Obviously, the only thing with going through investigations is sometimes that can inject a little bit more stress because it sort of puts more pressure on because you're focusing more on what the issue might be.
I did think that.
So, you know, it's up to you at the end of the day.
Yeah.
If you're not a stressed person, you might just want to go with the flow.
Yeah, so I've got options, I guess.
Yeah. Oh, lovely.
Yeah.
So if you'd like to lie down, Elizabeth,
Yeah,
on your back,
on my back,
head on
yeah.
the pillow.
Yep.
Okay, so we're going to do some kinesiology.
Yep.
So can I have a nice straight arm, other hand off your hip?
Okay.
And I'm going to push here, and you're going to hold up, stop me pushing.
Right, okay.
Don't let me push you.
Right.
Okay, so I'm going to push down, and you're going to hold.
Hold.
Yeah, and hold. So stop me pushing. So don't let me push your arm down. Yeah, and hold. Okay, same the other side, and hold. Good, okay. Can you raise a leg? I'm going to push here and hold. Okay, same the other side. Nice and strong and hold. Okay, so you notice got some weakness there. Each limb can't hold me at the moment, but there'll be a reason for that. So I'm going to find out why. Just touch your lovely red hair. So hold up with both, stop me pushing down and hold. Okay? And hold. No, okay, so you're not dehydrated, you've just had a nice glass of water. With this hand, can you upturn a finger and touch the roof of your mouth? Arm and leg together and hold. So nice and strong, you're going to hold up, I'm going to try and push you down and hold. Okay, not convinced. If you could release that for me, can I touch your tummy? Sorry if my hands are a bit chilly.
It's okay.
Ticklish? Okay, can you put two fingers into that place there?
Yeah.
That's your iliosacral valve. And then raising arm and leg together. You're going to hold up strong. I'm going to try pushing you down. Can you raise your leg? And hold. Okay, so not that one. So you can release. Can you put a nice flat hand on your forehead? Raising again and hold. No. Okay, I'd like to, you can release that. So this happens occasionally. What I'm doing is I'm looking for a strong, it's like the foundational level of the body, an IPSI test, and I'm using you to help me test other things that might anchor to create a strong test. And at the moment, none of them are producing a really strong test for me. So I'm going to systematically go through each one and treat them, and then keep coming back to that initial test to see if we can, between us, create that strong test.
Okay.
So are you all right with me touching inside your mouth where you were just touching the roof of your mouth?
Yeah.
Yeah? So I'm just going to put a finger on the roof of your mouth. That's it, lovely. And relax your jaw and just breathe. Just relax. Some people, when they close their eyes during this, see beautiful colours. But completely up to you. So it might feel like a long time, but I'm only going to be here for about a minute or two. Just relax, relax. I'm tuning into the cranial bones via a place called the Sphenobacilla synchondrosis, the SBS. There we are. There it is. So I'm using a kind of healing called Qi Gong. Resting the pad of the finger very gently. Sending Qi Gong through the SBS, realigning very gently and subtly to the cranial bones. I can feel that subtle movement. And as we breathe, of course, the cranials, just like the whole body, gently expand and contract. Lovely. Okay, we're going to go back to that initial test. Arm and leg together. I'm going to push with both. You're going to hold up and hold. Okay. And the same the other side. And hold. Okay. I'm going to treat your abdomen. So if you could raise your tops for me and lower your waistband just so I've got full access to your abdomen. I'm going to give you some tissue just to tuck around your clothing. So if you could tuck that round your waistband.
Yeah.
Lovely. And then the bottom of that tissue round your tops.
Yeah.
Then I'm just going to check which oils might help you today. Do you mind me asking where you are with your period at the moment?
Today I'm on this will be the 21 days.
Okay.
So today, yeah, 21.
So there's a possibility you could be pregnant then?
Maybe.
At 21 day. Whereas if it was like day 1 to 14-ish, then I'd be able to use all sorts of essential oils.
Okay.
But after day 14, you know, generally, then I'd just have to be a little bit more careful.
Right.
So I've picked out some oils that are okay, and we're just going to test them all with you and see which one your body is happy with.
Okay.
So, with this hand, can you give me a thumb to little finger together nice and strongly? And I'm going to try and pull them apart. You're going to hold them together strong and hold. Nice and strong. And then with this hand, hold that and put the bottle to you. Okay. Just, yeah. And then back to this one again and hold. Okay, it moved slightly. And holding that one, just put the bottle to you so it's touching you. And hold. Really strong. I'm pulling quite strongly, aren't I? And hold. Lovely. Okay, we've got frankincense and mandarin. And hold. Really strong. We've got sweet orange. That's a nice one. And hold. Lovely. Okay, we've got 4. Hoe leaf as well. Okay, the oil is warm, but my hand might feel chilly. I'm sorry, I'm sorry. I'll get used to it. Oh. Okay, so this particular treatment is called an Anmo Fu. It's a deep abdominal massage, a Chinese technique from traditional Chinese medicine. It's a beautiful technique where We use quite a lot of oil, and I'm using oils that are all therapeutic for the reasons you've said on your consultation form.
Okay.
But also they're very good digestively, hormonally, excretory, so all the systems that are contained in the abdominal area. We've got the digestive system here,
Yeah.
and we always think that's the only thing in there, but there's a lot more besides that. We have a lot of lymph nodes, which is all to do with the defence, the immune system, keeping us strong from bugs and germs and infections. We have a lot of hormonal activity down here because of the reproductive system, which I will be careful with at the moment. We have the excretory system, and we also have the urinary system, so adrenals, kidneys, ureter and bladder. So there's a lot going on in this lovely area. And of course the good thing about it is it's not covered with bone, it's soft, unlike the chest, which is covered with ribs and sternum. And how does this feel when I'm doing it?
Yeah, that feels okay. Yeah.
So coming up the descending colon, just agitating in the wrong direction first of all, in order to encourage in the right direction. And the same across the transverse. And then the right direction, not going too deeply, fairly superficial. And then down the ascending and up. And then a lovely double circular, so small circles within a large circle. Following the correct direction of the workings of the gut. Lovely. This oil smells amazing. Can you smell it?
It smells amazing, it really does.
Yeah, so we've got, just to remind us, we've got frankincense, mandarin, sweet orange and whole leaf. So you've got two fruits there, orange and mandarin.
Okay.
The whole leaf is lovely. It's quite musky but also spicy. And then we've got frankincense that you may be familiar with. It's a resin from a tree, beautiful frankincense tree. We associate it with Christmas, don't we?
Yeah. But yeah, that does smell very nice.
Yeah, it's a nice mix. You've got two top notes, a middle note and a bass note there, so perfect mix. Okay, can you give me 3 nice long breaths, please, Elizabeth? Lovely, feels clear. And the same again, three breaths. A little bit sensitive on that
Yeah.
one. So this is an area called the iliosacral valve. I'm just going to give it some attention, but very gently. So sometimes the valve gets blocked. It's smarting a little bit, isn't it? Is it sore?
A little bit, yeah.
Okay. I think we might have found the problem as to why we couldn't pass that initial test. This is probably it.
Okay.
Okay, don't worry. We'll sort it. So this valve, just like in our circulatory system with valves in our blood system, it has little flaps. In the tube it has little flaps, and those flaps allow, in this case, food, and obviously in the blood system you're talking blood. And as the food passes through this valve, the flaps should naturally open and close. So that's what it would be doing most of the time.
Yeah.
But sometimes, with all of us, there can be a little issue there. So either a nugget of food gets stuck in the flaps and it makes the flaps stay open,
Right.
and it either blocks the passage or it means it stays open but other food is going through too fast, and therefore you won't be using and assimilating all the nutrition from the food that you are eating.
Right.
So you'd probably feel quite drained. Your going to the toilet would be quite loose and frequent in that case. Alternatively, nugget of food can be blocking the flaps and they could be closed. And in that way, you'd more likely have gas, bloating, pain, constipation, infrequent going to the toilet. And it again would make us sluggish, but only because we've got a stagnation there. Whereas if the flaps are open, it would make us sluggish because we're not getting the nutrition from our food. We're not getting all those vitamins and minerals.
Yeah.
Another thing that can happen is the valve can twist. There can be torsion there. Or there can be something pressing on the valve from outside the system. So from, in this case, an ovary or your hip or from the colon, so it could be pressing on it, so impinging the valve. I'm not sure what the situation is, but all I know is that I can sense with you that there's obviously some sensitivity there, so I'm just helping you open it, and by moving the food in this manner, so from the umbilicus, from the tummy button all the way to the hip point on your right hand side, moving it this way will always clear the valve. Yeah, whatever those, one of those problems could be. Yeah. Is it starting to feel a little easier?
Yeah, definitely. Yeah.
So this is something you can do at home as well, and I encourage everyone to do this. So once you've located where the ICV is, the iliosacral valve, which is halfway between your navel and your hip point on your right hand side, so it's roughly about there, then clear it occasionally by getting to know how it feels. The best time is when you're in the shower, you've got some shower gel, you haven't got clothes in the way and waistbands, etc. And just get to know it with like 2 thumbs into that area and feel like, how is it today? Is it having a good day? Does it feel blocked? Does it feel absolutely fine? And then, so massage it a little, and then if you want to, clear it in this direction. Just gently, don't hurt yourself, but it's sort of make a friend of your ICV, get to know it and give it a good clear every morning in the shower.
And it's always on, obviously my pain is on the right, so...
In your groin.
In my groin,
It is. That could be associated. I'll come on to the groin in a bit. Okay. I mean, there is another valve on the other side called the Houston valve, but it's more commonly the right-hand side that I find problems with.
Okay.
When do you get the pain in your groin? What time of day or what situation?
So, I work on my feet, and I work 8 hours 45. So I would say maybe halfway through my shift, I start to feel the pain in my leg and in my foot, and the dull ache on my left side starts. And then when I'm at home in the evening, when I finish my shift, the pain in my foot is just a dull ache, and I'll feel it sometimes in my foot in the morning, like a dull ache again.
Okay.
And the groin pain again when I'm sat down at night time.
Okay.
The dull ache.
Right.
Yeah.
Okay. Right. So let's retest your arm and leg this side up for me. I'm going to push. You're going to hold up nice and strong.
Yep.
And hold. Okay. Same the other side. And hold. Okay, we're getting there. I can feel some, there's some more strength coming back.
Okay.
Yeah.
Right.
Can you put this hand again on your forehead? And raising this side nice and strong and hold. Okay, can you put that hand on your forehead and give me this one? This leg up and hold. Okay, you can release. Okay, so I want to have a look at this groin pain now. Do you mind me touching this area around here? So is the groin pain around here?
Yeah.
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 So where I am now, this is the hip bone, the iliac. Oh, is it painful there as well?
It's tender.
Yeah.
Yeah.
Okay.
Yeah.
Let me just have a little feel. So it's tender inside the hip there.
Yeah.
How about this side?
Just normal.
No, just to give you a bit of comparison.
Yeah, I'm definitely feeling something going off there.
Okay.
Yeah.
Okay. So when our hips are misaligned and the pelvic girdle is made up of two iliac and a sacrum at the back, which is part of our spine,
Right.
and then a meeting point at the front called the pubis symphysis,
Okay.
then because it's got three joints in the pelvic girdle, there can be misalignment where it can either open at the front or open at one of the two back places,
Right.
or it can twist. It can drop on one side, and all of these things would mean it would be in your interests for this to be good in order to be more fertile, to be able to hold a baby. So
Right.
it's really important that the pelvis is in the correct position for best fertility chances.
Yeah.
So I'm just going to give this a little feel here. Oh, bless you. Right, can you put two fingers in there like that? Yeah. And then give me this bent arm again, little finger and thumb together. I'm going to try and pull apart. You're going to hold together strong and hold. Okay. I'd like you to touch a slightly different area. Yeah, strongly. And hold. Okay. We're going to come up a bit higher into the inside of the iliac and hold. Okay. You can release this hand. So none of those were failing, but they were giving you pain.
Yeah. Yeah. When you've just said that about my hip alignment, always tried to get to the bottom of it, and when I went to see a physiotherapy, he asked me, when I was little, did parents ever tell me that there was ever a problem with my hips? And I said no. And so maybe that's where he was going with the hip thing.
Okay. Okay.
But,
you're nice and tall, aren't you? How tall are you?
5'11".
Yeah.
Yeah.
You see, that's a lot on the hips, isn't it? And especially if you're standing or walking most of the day.
Yeah. Yeah. All the shift.
Yeah.
Yeah.
Okay. Let's just have a little look at this foot. So Give me this hand, little finger and thumb again, elbow down and hold. Yeah, okay. So it's not the ankle then, it's the foot, is it, that hurts? Whereabouts?
And the ankle, it's like all of the foot and the ankle. And it's all of it. And then like when I squeeze it, it's like a horrible pain, but it's a nice pain because it like eases it.
Yeah.
If that makes sense.
Yeah, relieving pain.
Yeah, relieving pain.
Yeah.
That's the word, yeah.
Yeah, yeah.
Like there.
Yeah.
It's
little finger and thumb and hold. Yeah,
Oops.
I thought that was going to.
Oh.
Yeah, yeah, yeah. So it's about there.
yeah,
Yeah.
100%.
Okay.
Yeah.
You haven't been to a doctor about it then?
I've been to a podiatrist.
Did they say it was plantar fasciitis or not? No.
No,
it's not. It's just misalignment then. It's probably coming from the hip.
Yeah. She just said have some orthotics.
Oh.
That's what
Do
she
you do
gave
that?
me. I do them.
Oh,
the orthotics.
Okay. Right. Have you got them in your shoes today?
No.
Okay. Because when you've had a core therapy, because I'm going to realign you, if you then go and put orthotics on, it'll put you back to how you were when you arrived. I wouldn't want your body to have all of this repatterning and then the orthotics will just upset it.
Right, okay. So I haven't got them in today?
No.
No?
Yeah. I mean, I would probably not wear them for a little while.
Yeah,
but
yeah, I
only
can do that.
if that's all right with you.
Yeah, absolutely.
Okay.
Yeah.
Right, this shoulder. So, can you put your arm there and give me this bent arm, little finger and thumb, and hold? Okay. Can you put your arm out there? Yeah. This one again and hold. Good. Arm up by your ear on the pillow. That's it. And hold. Good. And up into the air. That's it. And hold. And turn your hand round. Yeah. And hold. Okay. So that's the only one that failed. So when you've got your hand out and your thumb is down rather than up, that is the position that your shoulder doesn't like.
All right, okay.
You can release it now.
Yeah.
So when you'd be doing that, it's like closing a door,
Right.
a cupboard or something,
Yeah.
or maybe something else that you know of that you do when your hand's out in front of you
Okay.
with your thumb down.
Yeah.
So there's something that your shoulder doesn't like that you do, and maybe it's on a regular basis with work or not driving. Something. You'd have to think about it.
Yeah. I'm just thinking at work, I do carry a radio and I carry it there. I don't know what that could be.
No. Okay.
No.
Would you like to turn over? Okay, so coming back to that little finger and thumb, I'm just going to test the alignment of the back of your pelvis. Little finger and thumb together and hold. Okay, so that came apart and, ooh, yeah, whistle and hold. Yeah. So I'm just anchoring you every time I find something and hold. Yeah. And hold. Good. Okay, so you're right. So the worst was quite low down, and then east and north were sore. I'm just updating my notes. So I'm just feeling into the back now, giving the whole back a little Tuina. Is this sore, Elizabeth, or is it okay?
That's okay.
Yeah?
Yeah.
Tell me if it's too much, won't you? So I'm just rejigging and agitating the spine, see what it tells me, see any areas of particularly warm or cool.
It's just tender there a little bit.
Yeah, that was really tight there, wasn't it? I could feel that, yeah. What have you got on? You've got some big stuff on here.
Oh, I've just got my sports bra on.
Oh, okay, yeah, I can feel it creaking.
Yeah.
So I'm moving the pelvis to try and create some flow, some softness. But also not wanting to agitate it too much, just because of the time of the month, and in case there's a pregnancy. And coming round to the shoulders. Oh, a little bit sore there, isn't it? Yeah. We're definitely finding the spots today.
What causes this alignment in women? What, is it just something that happens?
It's very common. It shouldn't be there, but it is very common. And one of the main reasons is asymmetrical actions. So it's things like, well, so much actually. It could be things like housework, like hoovering, sweeping, raking, mopping, anything that's one-sided. And of course we don't tend to switch hands and feet when we're doing things like that. We just use our handedness, you know, right side, left, whatever. Other things, obviously, things like mouse work with computer, one hand, one arm doing it, so that will put the shoulder and the neck out. But with the pelvis, it's normally more physical things, like also sports. There's a lot of sports that are one-sided, like hockey, tennis, golf. You know, they're asymmetrical, not like swimming or cycling. Yeah. So that's something to be careful of after you've had your core therapy. Just try and make sure, at least for a few days, to avoid actions which are just one-sided. And if you do have to do them, just be mindful and then keep switching sides. You know, most of us can achieve both-sided actions. It's just trying to remember to do it and not go into your usual familiar routines. So that will help your pelvis and your neck and your spine. And other things that help are good movement. So regular yoga, stretching, releasing, turning. So I've put some on my YouTube channel on the playlist, which is called Drew Yoga Activations and Meditations. There's one activations video in there and several yoga ones. And by following those every day, you will be able to release the spine, the neck and the pelvis. And they're all symmetrical. So they always work on both sides of the body equally. Yeah.
Oh yeah, that'd be good.
Yeah, I really recommend it for everyone. I do my yoga every day, and it's what keeps me aligned. Yeah.
Yeah, I was looking into yoga and things about stretching because I don't know enough of that.
Yeah. It's easy to fall into our own ways of not doing things, but once you do them, you realise how much the body loves it and rewards you with good health.
Right, okay.
That's feeling a bit better up there now.
Much better, definitely.
So releasing the shoulder and the big toe in reflex terms away from the rest of the foot. So the neck of the big toe here. And then separating the shoulder from the rest of the back, the foot, creating some space just on the inside of that pad of the toe and down. It feels great once it's freed up. Lovely, wonderful, nice and relaxed, beautiful. This will really help realign, reset the pelvis. So this is the foot with a little bit of pain. Yeah. I can feel it right there. Yeah. It's quite solid there. Whereas you can feel the difference. This part of the foot is much softer over here. And then here, which is also on the instep, on the arch, it's actually quite firm. I feel like maybe your footwear or the way you stand is making that quite solid there.
All right.
I mean, obviously I can't see the foot right now, but that feels like quite a lot of hard skin on the outside of the foot here.
Right, okay.
Which normally develops because of the way we walk and stand. So maybe it's something to do with your footwear or the way you stand that's creating more solid skin under there.
Okay.
I'm just agitating it, moving it, and that will help soften the foot up, release some of that muscle spasm. Yeah, I think that'll feel better. Oh, let go, let go. That's it. You all right?
Yeah, I can feel that in my groin.
Interesting.
Yeah.
Yeah.
And my knee, in my knee as well.
Okay, let go, let go. I've got you.
Yeah.
I've got you. Lovely. Well done. Well done. let it go, let it go. And down, down, down. Tuning into the pelvis, the alignment, hips, but also the contents, the soft fascia and tissue, beautiful organs and ligaments. Just connecting and reminding the whole area everything's okay. The beautiful thing about Qi Gong is that once you get past the physical level, the body relaxes, my hands relax. I tune in more to the beautiful flow of energy. Mentally calming, emotionally reassuring, physically repatterning, and spiritually awakening. Lovely. Okay, Elizabeth, nice and slowly, if you'd like to turn over onto your back, nice and gently. How's that pain there now?
It feels so much better.
Yeah, great.
Yeah, absolutely.
Okay. You don't mind me touching here, do you?
No.
Okay. I'm putting a lot more pressure on than I did earlier.
Yeah. groin pain. It doesn't feel as tender. It doesn't. Yeah. It feels okay.
So earlier when I touched your hip, that really hurt,
Yeah.
just actually the bone.
Yeah.
And then also when I came on the inside of the iliac, the hip,
Yeah.
to the groin area, that was really sore.
Yeah.
You were wincing.
Yeah.
That feels all right.
Feels brilliant. Yeah,
Wow.
it does.
Core's just amazing. It even staggers me.
Wow.
So I'm hoping, not that you had any digestive upset and stomach pain, but we treated the stomach.
Yeah.
So I'm hoping that has helped other things as well, up into the shoulder, down to the foot
Yeah.
and the groin. So I'm going to give you a neck release now.
Okay. I've never heard of core therapy until I saw it on YouTube.
Yeah, I'm very, very lucky to know what core is. I just think it's the best treatment. I mean, I'm obviously an aromatherapist, reflexologist, and I'm a Reiki master and all these different things. But when I discovered core therapy 10 years ago, it was like waking up. And it brought all the other therapies together because I can bring the essential oils into core therapy like we did with your stomach massage.
Yeah.
I bring reflexology in because when I'm treating your feet, I know exactly where to treat, for instance, your neck or your back or whatever on your feet. I bring in Reiki quite frequently because even though I use Qi Gong, which is another form of healing, can I open these just slightly to there? Is that okay? Then I'm bringing in all this form of healing during a core treatment. So you're sort of getting 6 different therapies all in 1 hour.
And all those therapies, I do. Obviously, I've tried before,
Yeah?
and I do really rate all those.
Yeah, they're great.
Yeah.
So nice and heavy, let your head go, heavy, 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 lovely, beautiful. So letting your head naturally tilt back, fantastic. Oh, brilliant. So I don't know if you can feel that, but where a line, my line of fingers is sitting at the base of the back of your head, there is, or there should be, a little gully, like a little valley in between the bottom of the cranium and the top of the spine. And in a lot of people, that doesn't exist because of whiplash and poor posture and phone use and computer use and all the different ways of abuse that we abuse our bodies and particularly our necks. But I've been able to, first time of doing this, manage to get my fingers into that little gap. So this will be really helping you right now.
Okay.
It will be allowing good flow of the blood circulation up around the head, so that helps with things like avoiding headaches and good brain function, so mental clarity, focus, memory, all these different things for brain function. But also it will be resetting your cerebral spinal fluid, which is the fluid that wraps around the brain and then goes down the spine and back up again in like a constant motorway. And that is so important for our nervine connections, brain function, etc. So that's so good that I've been able to get my fingers into that area, first time of doing it with you as well. Oh, little click there.
Yeah. That side normally gets very tight. Yeah.
I know it's probably feeling a bit tight to you, but actually it's not too bad.
Oh.
That's sore
Yeah.
there. I found one. Okay. Okay, keep breathing. Okay, let go, let go. You're doing really well. Beautiful. So just bouncing the spine side to side. Yeah, it's much better now. Relax, 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 relax. Yeah, lovely. So looking at the spinal processes, this is the tight one. So this is at about C3. Oh, it just moved. C1. Oh, it's tight there. Cool. Okay, let the breath make it go. Dissolve the pain, dissolve the misalignment, letting the neck realign and find its flow. Okay, let's have a look at the other side. Okay, let go, let go. Release the whole weight of your head. Giving it a good squeeze, release, massage. Okay, oh, let go. That's it. That's the one. Cool. Oh. Okay, so we've got C2 coming out saying hello on the right hand side. Okay, we're going to do another neck release up and let go all the way back, letting your head naturally tilt. Beautiful. Let go, release. That's it. Beautiful. So a good neck stretch, and what this does is it helps create space in the whole spine, and thereby any vertebra that are misaligned have room to go back into alignment. They're not being forced out. Yeah, so that C2 on the right hand side is being a little bit stubborn. Oh, I bet that's really sore. You're doing so well, Elizabeth. It's coming gradually. Oh, that's better. Okay, let it sit, let it sit. And let go. Yeah, it's better. So I think what I'm going to do in the massage that follows is I'm going to work more on that neck, well, and your foot, groin, etc., because now I know all the areas that need a little bit more attention. You mentioned about your shoulder, so I'm just going to give your shoulder a little bit more core therapy. Now I know it's your left shoulder, but I'm just going to do your right first. So relaxing your elbow, that's it, nice and heavy. Lovely. Let your whole arm go. Ooh, that's good. Nice click. That's it. Repatterning the neck via the arm and shoulder. That's it. Lovely. Loose, loose. Oh, I think the sun's coming out outside. Letting it go. Working on that shoulder. Right, now we've got a comparison to the other side. Okay, letting it go. I've got you. Beautiful. And again. Nice, good. Okay. Doesn't feel too bad. Oh, wrist is clicking. Okay. And down. Just feeling into that shoulder. Is it at the front? Yeah, I thought it was. See, I didn't know that, but I could feel this tension here. You're doing really well. Oh, bless you. Okay, nice deep breath in and a long breath out. I'm not particularly pressing, I'm more giving the area Qi Gong. And again. Lovely. Okay. Okay. So we're just going to retest a couple of things that weren't happy right at the start. But before that, can you take a deep breath and have a nice long stretch?
Yeah. Oh.
Okay. You with me?
Yes.
Yeah. So arm and leg up together. I'm going to push, you're going to hold up nice and strong and hold. So much better than before. You couldn't support that before.
Oh wow.
Yeah, but
Okay.
let's see. And hold. Okay, it's going down a little bit that side. I'm just wondering why that might be. Let me just have a little feel of that back of the left hip. Is that sore there?
A little bit.
And arm and leg again and hold. Okay, it's that leg that's going down. I wonder what else could be causing that.
This left side. Oh. The side that I don't have problems with.
Apart from your shoulder.
Yeah.
And again, so arm and leg nice and strong and hold. Can you not support that leg? Let's try doing it on its own. So put the arm down.
Yeah.
And now just the leg. I'm going to push and hold. Okay, now two together and hold. Yeah, so it's going down. So you can release it.
Okay.
Yeah. I'll tell you what I'm going to do. I'm going to do your hip float. I think it's probably misaligned. Yeah, I can see it is. So, everything's up on your left-hand side. It's down on your right. Let go. Okay, so this arm and this leg again, nice and strong, and hold. Just try this leg on its own, just put the arm down. I'm going to push and hold. Okay, so that's strong.
Yeah, okay.
Try it again and hold. Much better. Okay.
Okay.
I think sometimes it's to do with the brain locating the muscle that you need to strengthen on request.
Right.
So your brain could go to your arms easily.
Yeah.
But to get to that leg, found it difficult to be able to say, right, which muscle is it that I'm needing to stay strong, and I've got to do something else at the same time. It's almost too much.
Right.
We managed to get it strong on this side after a few core techniques, and then once I repatterned the back of the pelvis and the hip realignment, we did get it strong on the left as well.
Right.
But if you were to come back, I know what I'd need to go straight to have a look at and treat. Having said that, there are lots of core therapists up your way. So if you did want to go somewhere nearer, because I know it's a long way for you to come, I really appreciate it, but you know, it's a lot of travelling for you, then you know you do have quite a choice up north.
Okay. Right, okay then.
But I'm very happy to treat you, so either way. Okay, so we are going to give you a full body massage now.
Okay.
And give you some nice warm towels to get under.
Lovely.